All right, so hi, I'm Neha Kandi. I'm a high schooler from Texas, and I'll be talking about the Medicaid disenrollment crisis and some possible solutions to it. My mentor was Lisa Smilin. So, what exactly is a Medicaid disenrollment crisis? When COVID-19 was declared a public health emergency under the Families First Coronavirus Response Act, the federal government provided those eligible for Medicaid continuous Medicaid enrollment due to job instability and economic recession. After COVID-19 was no longer a public health emergency under the Consolidated Appropriations Act of 2023, the federal government instituted an unwinding, or the rapid disenrollment of continuous Medicaid coverage. Most people who were denied Medicaid were denied based on technicalities, such as paperwork issues, and others were denied since their income was higher than the bar allowing someone to qualify for Medicaid, which means that their income is too high to be eligible for Medicaid, but in many instances is too low to pay for another type of healthcare insurance. This situation can put people who have been denied Medicaid on an income basis in limbo, as they can't find any other source for healthcare coverage. So let's look at some basic statistics. The chaos of disenrollment is affecting over 16 million Americans. According to Kaiser Family Foundation, the three states with the highest rates of Medicaid disenrollment, so this is due to a mix of procedural and income-based disenrollment, are Texas, Florida, and California. A closer look at the demographics of the individuals affected nationwide also raises an alarming concern, since Hispanic and African American populations are the most affected by the current disenrollment process. Within these populations, the age demographic being affected the most is children. Hispanic children, so this ranges from ages 0 to 18, are currently the most affected demographic. These issues put people in a precarious situation, as the solutions to moving forward can be difficult to find. I just want to reiterate this number because it is a really big number, and it really emphasizes how many people are being affected. So let's take a deeper dive into the problem. So I'll be referring to two different terminologies. So one is procedural disenrollment. So this is a termination of coverage for people who otherwise were eligible for Medicaid. And then there's also income-based disenrollment. So income-based disenrollment is when the income is too high to be eligible for Medicaid, but in many instances too low to pay for another type of healthcare insurance. We'll look at a procedural disenrollment first. One primary issue that may be that most forms required to apply for Medicaid are in English, which may not be the primary language for everyone, and English fluency can be limited in certain populations. While many states have made significant efforts by offering services in 33 plus languages, 19 states, such as Texas, Utah, and Rhode Island, continue to offer their services only in English. According to the Kaiser Family Foundation, the procedural problems associated with the unwinding process affect mostly underprivileged and minority communities, such as the Hispanic community, and language barriers may contribute to this disparity as well. What is also lacking are services offered in Braille and large print. The number of states providing services with such facilitation for blind individuals is smaller than the states offering services in various languages. Only 19 out of 50 states provide forms in Braille and large print. The second issue stems from outdated state contact information. This can lead to states being unable to help those who need assistance filling out the proper documents. The timing of when someone files for Medicaid matters as well. Applying too early or too late can risk causing the application to be denied. The same goes for submitting one's application without a physician's statement. NPR News has reported that this predicament is something that the Centers for Medicaid and Medicare Services have been trying to help state governments with by setting waivers that offer a multitude of benefits, such as granting Medicaid access to those who make little to no income assistance in filing out forms and delaying disenrollment for 1 month to provide states more time to reach out to an individual to provide additional assistance. The second half of the disenrollment crisis stems from the fact that some people have been disenrolled because their income is higher than the maximum annual income allowed to be eligible for Medicaid. Each state has a different maximum annual income set and other requirements. According to benefits.gov, a website run by the US government, Medicaid in Texas is granted to a person when they meet the income requirement and if one of the following conditions applies. They're pregnant, they have sole custody of a child, they're blind, they're disabled, or the primary caretaker for a disabled relative, or if they're 65 years or older. Some people are forced to choose a different method to attain healthcare. For example, some people might pursue marketplace healthcare as an alternative to Medicaid. Others might seek employment opportunities that offer healthcare coverage as a part of their recruitment. According to the Center of American Progress, the Inflation Reduction Act provides alternative for lower to middle income individuals by providing generous subsidies for healthcare insurance through the year 2025. People must be educated about these subsidies to ensure that they have continuous coverage. People being disenrolled fall through the cracks with little understanding as to how to continue their coverage. Many important resources and potential solutions are often buried within a multitude of internet searches, or are not marketed as much, causing people to believe that there are no other options for them. So we're also going to take a look at experiences of those who are impacted by the crisis. These issues have real consequences impacting people who need Medicaid. Examples include the stories of Melissa Buford and Twanisha Booth. Mrs. Buford's story is one of the many who have been impacted by income-based disenrollment, while Mrs. Booth's story serves as an example for those impacted by procedural-based disenrollment. Mrs. Buford, who lives in Arkansas, helps others get Medicaid coverage. In her interview with the New York Times, Mrs. Buford talks about losing access to Medicaid coverage due to income-based disenrollment. Mrs. Buford's income was slightly higher for her to be an applicant for Medicaid, which puts Mrs. Buford in a precarious situation. Twanisha Booth, also a resident of Arkansas, is an example of an individual who has been disenrolled due to procedural reasons. According to her article with Politico, Mrs. Booth has been mailed multiple letters about her Medicaid status and the renewal process. The reason for Mrs. Booth's denial lies in the paperwork difficulties, particularly relating to child support. Under the Affordable Care Act, child support should be taken from the parent's income. Medicaid eligibility is usually given based on income, which means child support is not considered a factor. Errors in the application or accidental reports of child support and income combined can lead to Medicaid applications being denied. This possible error can lead to Ms. Booth and many others like her being denied due to income-based disenrollment. Both income-based disenrollment and procedural-based disenrollment originate from issues within the core of the healthcare system. There have been many opinions on this, with Senator Bernie Sanders also proposing this idea during his presidential campaign. Outside of the US, many countries have adopted this system. In Britain, for example, they use the National Health Service System, which pays for most out-of-pocket expenses, according to New York Times article about universal healthcare. While universal healthcare is a possible solution, it would be hard to implement in the US due to varying political discourse in the nation. Therefore, we must look at other solutions that are in place. There are alternatives and solutions to help those affected by procedural and income-based disenrollment. The Affordable Care Act Marketplace offers subsidies and a calculator allowing users to choose between eligible subsidies. The calculator considers the user's zip code, income, and family size. The website uses the calculations and can direct the user in different ways. If the income is low, the website will redirect the user to apply for Medicaid. If the income is high, the calculator links subsidies that allows users to reduce their monthly premiums drastically. Essentially, this calculator is an excellent resource for people who fall on different sides of the spectrum. The user can also apply for that subsidy on the same website or talk to an agent to sign up for it. Marketplace coverage under the Affordable Care Act is a viable option for those affected by income-based disenrollment. Marketplace is often purchased through states or the federal government. Some state governments, such as California, New Jersey, and New York, operate their marketplace exchanges. For example, in Texas, small insurance businesses facilitate marketplace healthcare. These businesses are usually given a commission or a flat fee from the government. Marketing is also crucial. While CMS has been trying to target specific areas using bright and catchy ads, there's also a need to improve their algorithms so more people can see it. CMS has been targeting over-the-top platforms like OTT platforms such as Netflix and Hulu, but these ads should also become more commonplace during commercial breaks. The content should also be more tailored to each state as well. As previously discussed, marketplace coverage is different for each state. Therefore, the ads should also be more tailored to discussing these options based on their state and the target audience. States should also be more inclusive regarding language availability on Medicaid applications. Applicants might not speak English as their first language, which can cause issues while filing Medicaid application. This can result in an improper or incomplete application, which can delay and disenroll people from Medicaid. And here's why the smaller solutions make a bigger difference. While the issue surrounding Medicaid is constant, the short-term solutions will pave the crisis. Long-term solutions such as universal healthcare should still be discussed, but people who are being disenrolled simply cannot wait 10 to 15 years for a solution to arrive. Until a final solution is enacted, the short-term solutions discussed previously would be, at the very least, alleviating some of the difficulties. And thank you so much for listening to my speech, and please let me know if you have any questions.
Awesome, 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 Neha. I really loved how it touched so many different aspects and made me think of some of the other presentations that we've heard today, social media and what Akilash just talked about as well. So my question is, what did you find in your research that surprised you?
I guess just firstly, it's like the sheer number of people who are being disenrolled, because when I first started this project in general, I was not aware that such a problem existed. And it perfectly coincided with the time I started Polygence. So when I was researching this with my mentor, I found that the number was quite huge and I didn't know about it. And also just how it kind of progressed and snowballed from there, that surprised me as well.
Wonderful. Thank you so much.
Thank
Great
you.
job.